Okay, so in this video we're going to see how to take the blood pressure. The blood pressure, it is the determination of part of the condition of the cardiovascular system, and it is given by the strength that the blood exerts, or the force that the blood exerts over the walls of the arteries. So the blood pressure has two components, systolic and diastolic. Systolic will be when the heart it is contracting, and then diastolic when the heart is relaxing. In order to measure the blood pressure, we use a manometer. In this case, this is an analog manometer, and then I wrap the cuff of the manometer into the arm that fits snugly, not too tight, not too loose. And then you have to put your bell of the stethoscope over the artery here in the antecubital area, and then the bell of the diaphragm, which is this, will go against the skin. And then the best way to measure the blood pressure is against bare skin, not clothing. Now, you will inflate this cuff with this inflator, and then when you are inflating, you shouldn't inflate more than 180 millimeters of mercury of pressure within this cuff, because if you do, it will be so painful for whoever you are doing the blood pressure, okay, or you're measuring the blood pressure. So once you inflate, or before you inflate, you have to tighten this screw all the way up like this, and then you inflate up to 180, and then once you reach 180, you will loosen a little bit this screw down, and then that will withdraw the air pressure within the cuff little by little, so you can read the blood pressure. Now, in order to read the blood pressure, you will be looking at the dial and hearing the sounds inside the within the stethoscope. Okay, so this dial has a series of numbers going from 20 up to 300. So once you reach 180, and then this gauge, which is the one that will go up and down, as it's going down this gauge, it will do a bouncing movement that will represent the systolic for the first sound, which is the loudest, and then you will see a series of bouncing movements of this gauge down, and when you reach the diastolic blood pressure, you will see the last bouncing, and then you will listen in your stethoscope the less louder sound. So then this is what we are going to do right now, so you can see that, and then you have to just synchronize whatever you're hearing with whatever you're watching here. So again, just tighten the screw, inflate, and then unscrew a little bit, listen to the sounds, now I hear the first sound there, 120. And see how the gauge is bouncing? And I heard there the less louder sound at 80. And then you can deflate it completely, just like this. And then you do it on the right side. And of course, before you do it, and after you do this reading, you have to sanitize the entire stethoscope, the earpieces, and then the manometer as well. And this is all for this video.